Welcome to I Didn't Know That, the show about things I didn't know. And I did not know what Dr. Big Brain is. I see the sign, I'm like, what is that? So we have Dr. Pankin in here with us today from Dr. Big Brain.
Dr. Big Brain, yeah.
What is Dr. Big Brain?
Dr. Big Brain. Dr. Big Brain is a neurofeedback therapy clinic, and we came up with that name because we're working with the brain and stuff, and then there's some family history to the Dr. Big thing, so we kind of decided to go with that. My son was kind of key in that, encouraging us to use that as a name, so we went with Dr. Big Brain. And what we do is neurofeedback therapy.
Which is what?
So neurofeedback therapy is a way to retrain your brainwave patterns. So if you have a pattern that is dysregulated or dysfunctional, we can retrain your brain through the process of neuroplasticity. So your brain can actually grow a new nerve fiber or a connection so that it can communicate more optimally and better. And then our brain works much more efficiently then. So if you are suffering from maybe a chronic anxiety or depression, that can be it kind of mitigates and kind of fades away because your brain now handles itself in those situations differently, and it becomes your new default. It stays with you the rest of your life.
And so what would cause our brain to get off track?
There are a few things. Chronic prolonged stress. So if someone who's under a lot of stress for over a long period of time, you think of people in war, stressful situation, that's a big factor. Emotional trauma, that happens to all of us at some point in our life, and some people do fine with it. It doesn't bother them. Others, it changes how so they always go back into that pattern. That's what PTSD really is some emotional trauma that happened and you just can't get back out of that loop. And the other way is physical trauma. So a blow to the head, a stroke, anything that creates a disturbance in our brain is going to change our brainwave pattern. And the last thing is chemicals or neurotoxins. So that's drugs, alcohol, medications. Too much of that over time can change how our brain works.
Okay, so then take me through what would happen. Okay, I've come in, I have a lot of pain, have a little anxiety. What would we do?
We would have a discussion first, go over that like a medical history. I'm going to ask you those type of questions. We're also going to have you fill out a couple of psychological assessments ahead of time. So we're going to look at your cognitive emotional checklist. There's maybe 50 different things, and you're going to rate all that. And then we do another one called the interactive self-inventory. It's 150 questions. And it just kind of helps categorize where you are. And then we do what is called a QEEG, a qualitative electroencephalogram. So what we actually do is record the electricity from your brain and we put it in, into the software.
Is that what those are for?
Yes, so we use one of these beautifully, our primary color caps, depending on your head size, and it literally just measures the electricity coming off your head, off your brain, and we upload it into the software, and it is compared to this large database of other people who have done this for the last about 50 years. And we'll get a report back then saying this area of the brain has a dysregulated pattern, and these two areas are the most prominent ones. So once we see that, we can, it's going to give us a nice report, and it's going to explain that, and I go over that with the patient.
So it's like a map almost?
It's a map, and then so we compare all these different, wavelengths and all these different symptoms, and does it correlate well to the assessments that were filled out? So does it make sense what you experience in real life? So if the EEG matches up and correlates to what you are experiencing every day or weekly or in your life, you can make a very informed decision whether or not neurofeedback therapy might be able to help you. Okay. It's pretty cut and dry when we see that type of stuff.
Do you have an example of a map?
Or
like an assessment, I guess?
Right, so I'll turn this one on. So this is the screen I'm looking at. So we are doing C3 and C4, so right in the top of the head. So this is the left side of the brain, this is the right side of the brain. And that is the actual brainwave electrical, it's called an oscilloscope. and we're reading that. So it's just about ready to record. It's also looking for like muscle contraction of your scalp. So we don't want to record that, so it's called a baseline for auto artifacting. So now it's recording, and it records for 60 seconds at that point. So we will finish that recording, and then we just move on to the next. We do it with your eyes open and with your eyes closed, because there's a pretty big difference on when your eyes are open, what you will see. And our neurofeedback is primarily done with eyes open, so that one becomes probably the most prominent one we look at in the end. But we want to know what happens when your eyes are closed too, because that gives us a little more data on what's really transpiring in our brain.
Okay, so then once it's done, then how?
So then we come up to a point where we are going to decide, is neurofeedback therapy look like the right thing to do? If it is, we do what's called a protocol. So a protocol is determined by the software, and it's what the treatment is going to be. So we are going to, now we talk about neurofeedback is a guided exercise. So it's going to guide your brain to a certain frequency, maybe on the left side, and a little different frequency on the right. So maybe it's going to decrease it on one side and increase it on the other to balance it out a little better. So a protocol usually is 15 to 20 sessions, and then that's about how long it takes for our brain to learn this new way to operate. And I have an example of that. So close this one.
And is a session, I mean, is this painful? What's?
No, people love to do neurofeedback because it's actually very enjoyable. It's very relaxing, and it's kind of fun. So this is somebody's, they're doing it's 30 minutes long, so they're on minute 29 already. Here's when these are green, and you're watching some type of media. So a lot of people watch Netflix, a series or a movie or something. So when you're watching that screen, when these graphs are green, that picture is very bright. And when it's red, like it's popping red quite a bit over here, that it'll dim down. If it's red on both sides, it gets pretty dark. Our brain wants to keep that picture bright. So you don't actually have to think about it. It's just your brain figures it out. And that is the feedback part of neurofeedback. So it's feedback to our brain to try to make that picture stay bright longer. So
you sit in that white chair there.
Yep, and sit at that.
You watch a movie or
right.
a TV
You got
show.
headphones on, and you just sit back. You got sensors on the spot part of the brain where this one is at O1 and O2. So that's going to be on the back of the head. Sometimes they're in the front. They can be on the top, and we're guiding those areas. And
the ones that you saw on the map.
On the map, and it's all based off of that.
Okay.
So they call this, another thing they call neurofeedback is EEG neurofeedback, because it's based off of an EEG. It's you can treat someone, say someone has ADHD or symptoms of ADHD, or a child or something, and you give them medication, or this doctor decides that you decide medication, and it doesn't work. Well, if a kid has true ADHD, they're typically going to have an under-aroused brain. So you give them that medication that's a stimulant, and it arouses their brain and it calms them down. That would be when you do the EEG, you know if he has an under-aroused brain or does he have an over-aroused brain, that similar symptom pattern to someone so they don't focus well, they're distracted easily. So it's much more precise in knowing what are we treating. And that's why it's the most important visit to do is the first visit, because you gain all that information. And then when you're going to make the decision, at least you have, I got this to go by. This is what it shows. It fits with what I've done in my life, and this is what we're experiencing, and we want help. Or I need help, or whatever.
Is this considered natural?
It is. There's no drugs. There is literally nothing going from the computer to your brain. It's just literally measuring your brain wave, the electricity from our brain, analyzing it, and then guiding you with the picture on the screen.
And what kind of a success rate have you seen?
So the people I've worked with personally, 95, 98% of people have improved noticeably. Some extraordinarily. People who were child with autism, struggling in school, struggling with their peers, struggling at home, did neurofeedback over the summer, went back to school in the fall, getting A's and B's, able to do group projects with his peers, doesn't have the anxiety, doesn't need to go see the school counselor on a daily basis. Changed his life,
Wow.
changed his
That
parents' life.
Sounds life-changing for everybody involved.
Right,
Yeah.
and is every case like that? No, but very good outcomes. I've never had anybody really who did, nobody who followed through and did what I asked them to do and followed through with the treatment everybody has done well. So I'm excited as heck. I've been a chiropractor for 30 years. This really fires me up. I love what I see with this and how it impacts people, because it's not just the person who's doing it, it's everybody their family.
And then, so you mentioned pain, depression, anxiety, ADHD. What other?
People can't sleep well. Insomnia is a big one. Learning disorders. Kids who struggle at school because of, dyslexia is one. It does help somewhat. There's quite a bit of study on that one. But other learning disorders, it seems to help with that. Memory. People who, as we get a little older, sometimes we start having these early signs of memory loss.
I can
an EEG.
unfortunately relate to that.
An EEG can show us what is going on with that, and there's some really good outcomes with that. Does it prevent Alzheimer's disease? No. But can it delay the effects of dementia or Alzheimer's dementia? Studies suggest that strongly. What else? PTSD. I mean, that's a whole realm of things. There's anxiety, there's depression, there's anger, there's everything with that. But it's, and that's a complicated thing to treat, so it's, but there's lots of things. If it's, traumatic brain injury is the other one, that's the big one. Have you had a concussion before and just don't feel like you're the same since that time? Doing an EEG and finding out what's really going on, that can be a change your life type of a situation.
Wow. Yeah.
We always want, when we started this, the word that always came up was hope. I wanted to give people some hope, because a lot of times when you have a mental illness, you don't feel that very much, and you've just been told to live with it or suck it up. Come on, you can do better than that. Well, no, you can't. Maybe you can't. But this is a way to change some of those factors. Instead of having to rely just on this medication, maybe I can or change how my brain works a little bit, so either I take less of this or maybe eventually I can get off of it. But I don't change that for them. I'd have them go to their providers for that. But just changing how your brain works makes life a lot better for a lot of people.
And how young could somebody be to do this therapy?
You can do age 6 and up. Can you sit still long enough?
Oh,
I've
sure.
worked with a few that, ADHD at age 6 or 7. It's a little challenge, but we got through it, We make it fun.
Sure.
We're good with that, and they like to watch. You have them doing something they like, so they can do this. So I've had good luck with little ones, and I've had people in their 70s do this, and everybody in between too. So.
Sure. So what do people just need to call to make an appointment if they want to see if this
They
is
can call us at 218-210-2412, or the easiest thing is to go to the website, and then there's a email contact. You put your info, say I'd like to set up an appointment. Here's my phone number. Give me a call, and I'll get that email, and I do it that way too. So either way works. A consult runs about an hour and a half of time, so we talk and we do the EEG, and then we have you come back again to go over the results of that. So there's usually 2 visits involved. That's where you decide. That's when you make the decision. So you're not committed to doing a whole neurofeedback program if you come in once. It's just we want you to get the data so that you can make that decision yourself, and hey, this is, something I think I need to do, or we just got to do something different than we're doing, because these are all things I've heard people say,
I just think it's amazing. This is in Perham. We're in Perham, Minnesota.
That's right.
Neurofeedback Therapy with Dr. Pankinen, Dr. Big Brain. If this is something that you feel you could benefit from, please give them a call or email them. So I didn't know anything like this existed, so thanks for being on the show.
Absolutely, and thank you for coming here today. And you don't have to be afraid to check into this stuff, because it's just real life things, and we handle it that way too. So thank you for watching.
Yes, thank you. Thanks for watching. I didn't know that.